All right, thank you for joining us for our final day of the week of webinars. This is Catherine Shaw. I'm a business development assistant with the Kentucky Regional Extension Center. And this presentation is our practice success stories and grant opportunities. So today we're sharing highlights from the stories of practices we've assisted in our various service lines, as well as our current and upcoming grant opportunities and how those grant opportunities can help you achieve your practice goals. Kentucky REC advisor Mary Lou Vesey will be taking us through this section, and our Kentucky REC advisors, Christina Feathers, Robin Kernel, Seth Taylor, and Vance Drakeford will be on to share about their practices. And then we'll move on to the grant opportunities. Take it away, Mary.
Thank you so much, Catherine, and good afternoon, everyone. I'm happy to be with you today to help facilitate our week of webinar session on practice success stories and grant opportunities. One of the best parts of our job is partnering with providers, practices, and hospitals around Kentucky to help them achieve success across a variety of programs and ultimately to improve patient outcomes. So as we've mentioned several times already this week, the Kentucky REC has worked with over 5,000 individual providers, 95% of the federally qualified health centers and rural health clinics, and half of the hospitals in Kentucky over our 10-year history. So it was very difficult for us to narrow down our success stories. We would love to brag on you all day, but we only have 30 to 45 minutes. So here are just a few of the success stories with clients that have agreed to let us share their stories. So first up is Robin Kernel to share a success story in our value-based payment individualized assistance service line. Robin.
Thanks, Mary. So here, let me turn my video on. So yes, we want to brag on a small practice here in Western Kentucky. This is Dr. Outland's clinic, and he is in Western Kentucky, and they have just some details about their practice. Besides being small, they do not have an electronic health record. And so they have been submitting to the quality payment program since 2017 through claims data primarily, and that was just so that they could avoid payment penalty. So they set some goals when they started working with us at the REC. And one of those was, of course, to achieve more than just that minimum threshold. They wanted to qualify for some actual positive payment adjustment monies, and even more so to become an exceptional performer. And so they've worked with us for about 1.5 years now, and their progress included participating in a quality clinical data registry. And so because of the professional program that he participates in his specialty, there was a registry offered through that professional association. So the practice manager there has worked really hard, and for 2019 was actually able to submit data through that registry. And with her preliminary report, she knew that she had received a perfect score in the quality category for 2019, but I'm excited to report hot off the presses this week, they've actually scored a perfect 100 for their MIPS score for 2019. So they have went from just meeting the threshold to avoid any kind of negative adjustment to scoring a perfect score. So kudos to them. So I'm really proud to brag on them this week.
All righty. Well, thank you, Robin. That's amazing progress in a short time. Next, we have Christina Feathers to tell us about a hospital that she works with. Christina?
Hi, Mary. Thank you. Yes. So staff at Russell County Hospital have said that the Kentucky REC has been a great resource for their facility. They said we always seem to have questions, especially since we are critical access, and it is also nice to have the REC support when it is time to attest and submit data. So Russell County Hospital has been a great client, and we are recognizing them today for their outstanding work on the Medicare Promoting Interoperability Program. We actually could have selected them for a number of different areas, as we work with them on nearly every service line that is offered by the Kentucky REC. They truly are all-star clients. Today, we would like to showcase the work of the many individuals at Russell County Hospital who have collectively incorporated new tasks into their regular daily jobs to ensure compliance with the Medicare and Medicaid promoting interoperability programs, the security risk analysis, and their successful NIPS attestations. Their base team consists of the Information Services Department, which includes Monty Monsanto, serving as Department Director and HIPAA Security Officer, Sandy Jocelyn, Systems Analyst, Angie Hargis, Clinical Analyst and LAS Applications Specialist, Lisa Hoover, who serves as the Clinical Informatics Specialist within their nursing department, Kim Clark serves as their Clinical Systems Analyst for both of their rural health clinics, Ryan West serving as report writer, assisting with governmental reporting for attestations and entity-wide reports as needed, and Angela Scott, Director of Health Information and Case Management, HIPAA Privacy Officer, and Corporate Compliance Officer. Beth Ann Johnson, their registered pharmacist, also works closely with the group to ensure the pharmacy modules are functioning as expected and assist with report writing elements to enable the team's successful attestation. Their leadership team, Janie Landis, CFO, Judy Chenoweth, CNO, Patrick Franco, CEO, Professional Practice Director Barry Corbin, and Pharmacy Director Janet Wheat are all very appreciative of everyone's efforts while working on these special projects throughout the year, allowing them autonomy and lending both financial and moral support to the entire team. The members of Russell County Hospital's teams all wear many hats, in addition to their regular work that must also continue on in order to keep all systems going strong. They have all worked very closely together year after year to ensure Russell County Hospital has remained compliant, avoided penalties, and earned incentives. We are proud of their strong work ethic and dedication to one another, along with the patients they serve. So thank you, Russell County Hospital.
Great, and thank you, Christina, for sharing about their success. Now we have Kristen Gardner, who has a story about one of her PCMH clients.
My name is Kristen Gardner, an HIT advisor at the REC that has over the past 4 years had the privilege of working with Madison Family Clinic on various service lines at the REC. They certainly have been a joy to work with and are very dedicated to serving their patients with high quality coordinated care. I specifically want to highlight their work around achieving patient-centered medical home recognition. They are a small family practice in Richmond, Kentucky with 3 providers, and they first started their PCMH journey back in 2017. This journey started right as NCQA changed to a 1-year recognition program. I do want to add that they most recently were re-recognized after completing their annual reporting requirements. Their dedication, commitment, and teamwork, and hard work has contributed to the success of this organization's practice transformation. More specifically, they were rock stars at improving quality improvement and care coordination. They built a strong foundation from the start with finding measures that were really important to both providers and their staff. They accomplished wonderful work in integrating the PDSA quality improvement methodology into their practice. In addition, they work diligently to better coordinate care with providers in their community. Madison Family Clinic has not only achieved outstanding results, but they have also gained great satisfaction from their patients. They have been deeply committed to achieving great success over the past 4 years, making a difference in patients' lives and participating in and doing whatever is necessary to make their community healthier.
Hey guys, my name is Chelsea Young and I'm the administrative assistant at Madison Family Clinic. I've been working on PCMH for a little over 2 years now, and we are so thankful for the experience we've had working with the REC. I was hired in the middle of our clinic getting PCMH recognized, and I was really nervous, but a lot of great people from the REC reached out and they helped me to navigate the system and figure out what my place was and what we as a clinic needed to do to become certified. They answered all my questions, and I asked a lot of questions, and I just think it was really well worth it to have that peace of mind and to know that somebody out there is putting just as much effort into BCMH as you are to make sure that it's not only completed but done well. We're just really thankful for the REC and everything that they helped us to accomplish.
Well, thank you so much to Kristen and to Chelsea for sharing that story. We really appreciate it. Next, I get to brag on my Medicaid promoting interoperability, or as I'll always call it, meaningful use client, Mountain Comprehensive Health Corporation. Mountain Comp is a large federally qualified health center in Eastern Kentucky. They have clinics in Letcher, Harlan, Perry, Owsley, and Bell counties. They're also a member of the Kentucky Health Center Network. Mountain Comp has successfully tested over 40 eligible providers since 2011, and 11 providers have already completed all 6 years of eligibility for the program. So far, Mountain Comp has earned over $2.5 million in incentive money through the Promoting Interoperability program. When I first started with the REC several years ago, I completed my initial training. Mountain Comp was the first practice that I got to visit with one of the experienced advisors from the REC that had been working with them for many years. Together, we worked with them side by side for 2 days to complete all of their 2016 attestations. I was amazed at how prepared they were. Their documentation was perfection. I guess I was naive, and I thought, wow, if everybody does it like this, this is going to go great. But I quickly learned that not everybody is to that level. So Mountain Comp, I started with they set that bar really high for me. So I thought that, let's see, I've been working with Sharon Ford, Sharon Chandler, who's the Director of Information. Ever since, we've had monthly calls to review her progress toward the promoting interoperability thresholds. When I asked Sharon about her experience with the program and working with the Kentucky REC, this is what she had to say.
To be honest, we could not have done this without the guidance without the REC. They keep us very well updated on deadlines and on attestation dates and the websites, and of any changes that occur in any of the measures that we have. Every staff member we've worked with REC is very knowledgeable about all the meaningful use criteria, and and another girl that I work with on this, we both talked how we just could not do this without it, and we couldn't do it accurately and at the rate that we need to get the full dollar amount, that we're looking for. And so, like I said, they keep us on track, and we're always calling them and asking them questions, and they're right there with the answers, and they'll, check support. If they don't know the answer right then, they'll find it out for us.
Yes, they have been a joy to work with, and we have so many amazing practices. Honestly, you all become like part of our family. Sharon has 2 amazing grandchildren that were born real close together, so it's like you become a part of our family. We want to see the best for all of you. Next up, we have Seth Taylor, and he will tell us about HIPAA SRA client.
Thanks, Mary. So as Mary said earlier, we work with clinics all over the state of Kentucky, from one-doc shops to large multi-facility hospitals. And our focus is HIPAA privacy and security. And I'm not sure if you got to catch our presentations earlier this week, but we had some pretty good information in there. But we just wanted to kind of highlight, again, it's hard to pick just one practice, but and these numbers over here to the left are not actually for Mountain Comp, but we have some really good material from them. So to the left, you'll see that we have performed a risk assessment for a practice. We're not going to give names out of that practice, but the first year we did a risk assessment with them, they scored, we provide a HIPAA maturity level, and they actually scored a 68%. And then just to show like the help that we've given them and the ability for them to improve has, I mean, it's just amazing. They went from a 68 all the way to a 93%. And, you know, these people just appreciate everything you do for them, because our focus is the same as theirs. And, you know, we're coming into clinics and we're not auditing, but we're giving information and pointing out vulnerabilities that could possibly lead to a breach. And so sometimes you get people that, you know, want to protect that, but we're there to also protect. So we have the same goals in mind. And we've got a little snippet here from, again, Mountain Comp. We work with them on several different service lines. So you can go ahead and play the video.
We tried that once or twice in the beginning without any assistance from the REC, and found out that the services that REC provides for that security risk analysis is so much better than anything we did on our own. And, you know, at first it's kind of like, oh, they're going to audit us and they're going to find all these things wrong. We're going to be in trouble. But it's not that way. They're here to help. And they did find areas, you know, that we had some risk in, but they also provide you the information that helps you solve those areas that you're high risk in, or things that don't meet the requirements. And so the documentation even for that is wonderful through the REC, you know. And the folks that we've worked with on that, that have come for SRA have been wonderful. And, you know, and they, like I said, they provide the documentation needed, and they have actually found some things that we've improved on that needed to be improved on. So it's been a win-win situation for us on that also.
All right.
So this kind of, sorry, Mary. That just goes back to the point, you know, that that we are there to help. And like I said, we have trouble just picking out one clinic, but you know, we have so many rock stars and so many clinics that just appreciate what we do and do such an amazing job over the years of improving protection. And so, yeah.
All righty. Well, thank you, Seth, and thanks, Sharon, for that information. The last practice I would like to tell you about is part of our Kentucky Diabetes Learning Collaborative. The Kentucky REC started working with 5 practices in Western Kentucky on a grant from the Center for Disease Control and Prevention to the Kentucky Department of Public Health in October of 2019, so just last fall. Under the leadership of DPH, the goal of the project is to improve outcomes for patients with diabetes. And so with that project, we have 3 core measures. We want to decrease A1C poor control for those greater than 9, improve blood pressure control, and increase referrals to diabetes self-management education programs. There are several secondary and optional measures that practices could choose, including increasing eye exams and foot exams for patients with diabetes. Oftentimes, the first inclination that you might have an issue will be in your vision or in your feet, so we wanted to include those measures. We also include flu shots, because those are important, and we'd like to increase attendance in diabetes self-management education classes and increase documentation of patient self-management goals. So all of our practices since October have made amazing progress. The goal was a 5 to 10% improvement, and we do have to admit COVID-19 did slow us down a little bit from March to May, but our practices found creative ways to meet the needs of some of the most vulnerable patients, and TJ Health Regional Health is one of those successful practices. TJ has already met their goal in A1C control with a 5.7% improvement. For foot exams, they have a 15.5% improvement. Eye exams are up 8.4%. Flu shots are up 29.7%, and documented self-management goals are up 11.9%. One of the first PDSAs they were involved in was they contacted 30 patients that were newly diagnosed with diabetes and educated them about the importance of diabetes self-management education classes. And then they referred them to the class or workshop, as they call it. They also started tracking ACE and ARB therapy, statin therapy, flu vaccines, microalbumin, A1C, and diabetic foot exams, specifically for those patients with an A1C greater than 9. When I asked Deborah Smith, their population health coordinator for TJ, about her experience with the Diabetes Learning Collaborative, this is what she had to say.
My name is Deborah Smith. I'm an RN with TJ Regional Health. I'm the population health coordinator. We are focusing on population health in our clinical informatics department. We actually are in the process of starting chronic care management. And when we learned about the Diabetic Collaborative grant, that was a big focus for us because a lot of our population with chronic conditions in Kentucky obviously have diabetes. So we felt like that was a wonderful opportunity for us. The biggest eye-opener was in our first session. There were many things that we learned at the very first session, specifically the DSMES workshops that were available that we knew nothing about. We do not have a diabetic educator on board in our staff, and this was the main change for us in our PDSA focus, was the DSMES classes or workshops. Things like patients are more open if you say workshop rather than class. As the chronic care coordinator, I started from a report calling patients and educating them basically about the DSMES workshops that were available to them. And we started referring patients and offering those to patients. Our attendance grew rapidly from a very small number in 1 month of just a couple patients up to 30 referrals by April. That has been a big game changer for our patients in meeting their hemoglobin A1C MIP scores and meeting our quality care for our patients and bringing those numbers down and them being able to manage their own diabetes at home.
Thanks, Deborah and TJ, for being a valued part of the Diabetes Collaborative. Next is a look at the collaborative overall. Like I said, all 5 of our practices have done an amazing job. As you can see, we have already met one of our core goals and 5 of our secondary goals in a very short time in spite of the pandemic. One of the things Deborah mentioned was the diabetes self-management education class. The Department of Public Health has done an amazing job to take those classes, which are normally done in person at a health department, and given people around the state an opportunity to do those classes virtually. So if you have patients that have diabetes that you would like to refer, get in touch with us and we can let you know about that resource to get those patients into those virtual classes. So now that we have talked about and shared the success stories, let's talk on the next slide about some grant opportunities. So the first grant we'd like to talk about is the Diabetes Learning Collaborative. We are just finishing up the 2019 Diabetes Learning Collaborative. Will be finishing up in December of 2020, and our next collaborative will start in 2021. So as you can see on the timeline, right now we're in the recruitment phase. In February of 2021, our expert advisory committee will meet to finalize our goals and objectives for the next collaborative. In March, we'll be taking applications, and we will have several informational calls about the grant before that time and put that word out. In April, we will have a kickoff call and start data validation. And then our very first in-person learning session, like Deborah talked about, was so valuable, will actually be in May. Our second will be in October, and our third will be in February of 2022, with it all winding up in June of 2022 with the Learning Congress. Next slide. So if you're interested in learning more about participating in the 2021 Kentucky Diabetes Learning Collaborative, be sure to contact us at kyrec@uky.edu, and we will get you on our mailing list and give you more information specifically about those informational calls when they're going to happen and the application itself. So next up, we have Robin Kernel, who will tell you about a DMS 6 grant opportunity.
Thanks, Mary. So yes, this grant opportunity was for the formerly known as the Meaningful Use Program. And to participate in this program, there's a couple of things. Number one, of course, you need an EHR. Secondly, you must have participated in the Kentucky Medicaid Promoting Interoperability Program prior to February of 2017. So if you were not registered by then, unfortunately, we can't add new providers, but if you have folks that you think may have been registered, we certainly want you to reach out to us. And then additionally, there's a couple thresholds in regards to Medicare volume. So pediatricians must have at least a 20% Medicaid volume. All other providers need at least 30%. And so our services under this grant, and I'll tell you, we are in our recruitment period for program year 2020 and even 2021, include providing you with a gap analysis of your EHR reports to show where we can make some improvements. We work with collecting your Medicaid volume forms and helping you complete those. And then we also help you with attestation submission as well. Mary?
Great, thanks, Robin. Yes, and the program is ending in 2021, but you still have 2020 and 2021, so you still have time to earn some of those incentive dollars. So reach out to us if you're interested and we don't already support you. Next up, KHI will tell us about their mini grant or incentive opportunity.
So recently, KHI had applied for and received a $1.5 million grant, and we have I think Andrew had alluded to this earlier in either today's conversation or yesterday's conversation, and we are using those monies to allow providers, whether they be hospitals, pharmacies, ambulatory practices, to apply for a grant that would help them connect to the exchange. So I believe we're giving hospitals $15,000 and ambulatory providers, pharmacies, whatever, $8,000, and they can use it as they will to assist their efforts in defraying the expenses of connecting to KHI. And we have an application process. We'd be happy to disperse that. We've sent it out a couple of times, but if anyone would like an individual application, please reach out to me, the other outreach coordinators, whatever, and we'll make sure that you get that information. And the REC will actually serve as the disbursement mechanism for that funding. And as Andrew had alluded to also, we received an additional $1.5 million. So we've got $3 million over the next 2 years to help our stakeholders connect to the exchange. So please, our job is to get the money in your hands. Please reach out to us and let us help you get those dollars. Thank you. Thanks, Mary.
Thank you so much, Ann. Thanks for sharing. Next up, I'll turn it over to Brent McCune to talk about future grant opportunities and finish out this session.
Perfect. Thank you. This has been a great session. I love hearing about all the clients and the testimonials, and so that's been really great. So I'm glad you all put this together and shared this with everyone on the call. It just really shows, how useful we are to our clients across Kentucky, improving better patient care, better outcomes, protecting that patient information. So it shows, that we definitely are making an impact, and also our collaboration with KHI as well, and Department of Medicaid Services around their Promoting Interoperability grant. So it's a great session. So thank you for everyone that's participating. Also, I'd like to point out that future grants. And so at the Regional Extension Center, one of the things we like to do is always continue to search for other opportunities for our clients and potential clients across the Commonwealth. So we really focus on grants around quality improvement activities, around patient care, patient improvement, electronic health record implementations, anything to do, whether it's an ambulatory setting, inpatient setting, anything that we can do to help support your efforts in improving better outcomes in Kentucky around patient care. So as we look at grants, we reach out to our clients. If you are interested in potentially participating in a grant opportunity, we highly recommend that you go to our website, enter your email in there, and hit subscribe. We use our email to make contact out to specific providers depending on the type of grant that we're applying for, whether it's primary care, specialties, maybe as Mary mentioned around our diabetes learning collaborative. So we do some research and evaluate what type of providers would best fit that grant. So we highly recommend you utilize that email submission and get on our mailing list. I also want to point out that with that mailing list, we're not particularly looking at trying to give you a lot of spam email. We keep it very to the point. We're looking at providing you with maybe a future grant opportunity or some regulatory proposal or final rule that's out there, and giving you the opportunity to sign up for other educational events that we have. So definitely hop on that. Looking at future grants, to kind of give you an understanding of the type of grants that we apply for. Most recently, we applied for a cardiovascular improvement grant, and it's a research grant, but it's about doing quality improvement activities within practices, applying the Plan, Do, Study, Act model, so your PDSA model, on driving improvement within the organization, and then evaluating, did we receive better outcomes? Was there better patient engagement per se? So we have that available. One of the grants we haven't talked about today is our Quality Payment Program grant as well. And so if you do hear from our business development team, we have some funding from Medicare to reach out to those providers that Medicare is providing us. They provide us with a list of providers, and they want us to do outreach to these providers to make sure they realize that, hey, you need to participate in the Quality Payment Program. So if you're getting a call from the REC, it's really just to make sure that you're aware that your clinicians need to participate in a specific program provided by Medicare, so you don't receive penalty. So we have those items available as well.